Good morning, my name is Laure Morel. I'm the CEO co-founder of TORSKAL. And today I'm going to present you the Plasmonic nanophotothermal therapy for the treatment of basal cell carcinoma with gold nanoparticles. This work has been performed in TORSKAL and also in 3 different public hospitals in France. The skin cancer in the world, it represents more than 5 million new cases per year. That means that every 4 minutes, a person dies of skin cancer. 90% of skin cancer are non-melanoma. 1 American in 5 will develop a skin cancer in their lifetime. So USA, Australia, and Europe have the highest incidence rate, and the average annual cost of skin cancer treatment in the USA is estimated to more than $8 billion. So considering these features, we decided to tackle this problem. We have 2 types of tumors of skin cancers, the melanoma, 10%, and the non-melanoma, 90%. The first line treatment of this non-melanoma skin cancer remains surgical resection with standard margin of 5 millimeter to 1 centimeter. That means that the dermatologists have to remove large quantity of tissue, and some lesions are not resecable. The other treatments, called second-line treatment, are superficial, painful, and with a lot of side effects. The problem of this tumor is the high recurrence rate, 34%, multilesional cancer, and it requires biopsy, which leads to anesthetic scars. The PTT and the PDT are both light-mediated therapies. The PDT, photodynamic therapy, utilizes photosensitizers to generate reactive oxygen species by transferring photon energy into oxygen molecules. This induces chemical damage. The PTT, for photothermal therapy, uses photothermal agents for the conversion of light energy into hyperthermia. When we use the electrons on top of the nanoparticles, we use the surface plasmon of nanomaterials. We call this technology the plasmonic photothermal therapy. It's irradiated by near-infrared laser. And it's a physical mechanism of action. That means that it's a conversion of incident energy from photon absorbed by cells at a specific wavelength, near-infrared wavelength. There is a transformation of the ground singlet state photons into an excited single state, then leads to the relaxation, a non-radiative form of decay, whereby a return to the ground state is mediated by collisions between the excited photothermal agents and their surrounding molecules. The objective is the destruction in few doses the tumor by heat without affecting healthy tissue and without leading to anesthetic scars, and replace the surgical resection by an intratumoral injection of gold nanoparticles, which are safe, and the irradiation is a non-ionizing irradiation. How does it work? We inject the gold nanoparticles directly into the tumor. There is a cell internalization. Then we irradiate the tumor by non-ionizing radiation, and it leads to thermal destruction of the tumors by apoptosis. Our innovation lies also in an ecological process, green chemistry, is used to produce the gold nanoparticles. Indeed, we have substituted all the chemical compounds by medicinal plant extracts from Indian Ocean. The metallic salt solution is reduced by the plant extracts. It's we filed the patent. This protocol leads to stable and non-toxic metallic nanoparticles. They are very easily functionalized, and we leverage the physical properties of these non-toxic nanoparticles. These nanoparticles have been characterized by transmission electron microscopy and DLS. They are spherical, monodispersed, small nanoparticles, 15 nanometer sized, and very stable in different media. Why using green synthesis instead of conventional method, Turkish protocol? It's because it's simple, clean, and efficient. This protocol is safe and non-toxic because the use of hazardous materials and chemicals is totally avoided. Biocompatible and highly applicable for biomedical applications. Eco-friendly and economically cheap, as plant extract play a role as both reducing agent and stabilizing agents. Extreme external conditions like higher energy and pressure are avoided, and thus less energy is consumed, and can be used to produce gold nanoparticles at a large scale. We have assessed in vitro photothermal anti-tumor activity. These nanoparticles have no cytotoxic effect for small concentration, comprised between 0.1 to 0.3 milligram per milliliter. So we have demonstrated a high biocompatibility. Of course, the cell viability is power and time dependent. The highest power density is directly correlated to the lowest cell viability. We use a continuous irradiation at 1 watt, leading to a viability of 6% for 10 minutes of irradiation. We have applied these physical parameters for in vivo assessment of this photothermal anti-tumor activity. And first of all, the near-infrared laser alone exhibited no activity, and the gold nanoparticle alone were not cytotoxic. The combination of the two, gold and laser, leads to the thermal destruction. The increase of the single dose volume injected, 20 to 40% of tumor volume, did not significantly improve the efficacy of the treatment. We may thus conclude that the 20% of nanoparticle volume is optimal when injected in very small tumor size. That is 50 cubic millimeter lesions. And we observed no significant scars. In conclusion, we have performed the proof of concept of the photothermal therapy applied to a common skin cancer, basal cell carcinoma, using gold nanoparticles. We demonstrated that the stimulation of the nanoparticles by near-infrared laser allowed a significant exalted hyperthermia in few minutes, even at a low power density, 1 watt. The preclinical feasibility and safety have been performed on small lesions, 50 cubic millimeter, which allows us to study now the PPTT of larger tumors, more than 50 cubic millimeter. So the next step for us will be the clinical trials. So I wish good luck to our team and thank you for your attention.